Our mission is to close the gap in care for early intervention treatment for cognitive impairment. So Alzheimer's disease, dementias.
Welcome back to Startup Health TV, where we celebrate the entrepreneurs and the innovators who are transforming health. I'm Logan Plaster, here with my friend Paul Campbell, the CEO and co-founder at Moneta Health. Paul, great to see you.
Good to see you again, Logan.
I got to get an update on Moneta Health at AAIC in Philadelphia in July. But things move fast, so I know things have changed since then. But before we get to the news, just level set with us. 2024, what does the Moneta Health product and platform look like?
So Moneta Health, we are a brain health company, and our mission is to close the gap in care for early intervention treatment for cognitive impairment. So Alzheimer's disease, dementias, but really intervening early when we can have the biggest impact on quality of life and potentially slowing the decline.
So are these folks who know they have mild cognitive impairment? Are these people who are just worried about the potential for that? Who would get into the program?
Yeah, so who we treat are patients that have received the diagnosis, but oftentimes they come to us with those concerns, right? I've been forgetting where the keys are, or even more serious concerns than that from maybe a family member or a loved one. And so what we do is we can help them get that diagnosis through doing a very detailed cognitive assessment. And then once they're diagnosed and they have that information, we can start them on a treatment plan, because cognitive rehabilitation is, as we talked about it in Philly, is really like physiotherapy for the brain.
Okay. What's the standard of care now? So if I'm worried, I've got some memory loss, I go to my primary care doctor, I tell him that, what's the standard right now?
So that's one of the biggest challenges and opportunities, is that the current standard of care is really just getting established. Kind of rewind the clock back to 2011. I believe that was when the Affordable Care Act, the annual wellness visit, a dementia screening covered by Medicare, was implemented.
Yeah.
So then what would happen is you would get that screening, you would...
Was it accurate? Was it a good screening?
It's directional.
Okay.
Right? And the diagnostic tools, part of what, I think, the big developments in Philadelphia was what's happening on the diagnostic front with the biomarkers. But you would get that combined with your subjective concerns, maybe family member or the patient themselves. But then there was what do I do now? What is the early intervention treatment protocol? There are some disease sort of symptom masking drugs, but it was only till recently that we've had some of the disease modifying therapies. But cog rehab has been hiding in plain sight, right? It just hasn't been accessible to patients more broadly, and it hasn't been integrated into the care pathway where that becomes that part of the standard of care. And that's part of our challenge.
Okay, let's talk a little bit about cognitive rehab. You said it's like physiotherapy for the brain. People are familiar with brain games and memory games, kind of an unstructured way to potentially help your brain. Probably a lot of skepticism around the science of that. So tell us about what cognitive rehab can do.
So there's a lot of clinical evidence for the efficacy of cog rehab therapy. The Cochrane review from last year, which was really studying a number of European trials, and there are some here in the U.S., but really 4 pillars to the Moneta's implementation of cognitive rehabilitation therapy. So the first is a restorative treatment. So really working on those areas in the brain, whether it be short-term memory, procedural memory, executive function, and through repetition, you can stimulate those areas to help maintain and preserve. Second leg of the table is compensatory strategies. My glasses are a compensatory strategy for my eyesight. There are things in terms of cognition where you can use compensatory strategies. And then the other 2 are lifestyle education, because the way that whether we eat, exercise, sleep, stress, they all have an impact. And so we help raise the health awareness of both patient and family for the impact on one's cognition. And then the 4th is caregiver or family support.
Okay. What I'm hearing is that a lot of the means are relatively simple. Sometimes the lifestyle changes are things that you already know about, and yet you don't have the platform, the wraparound care. So talk to me about sort of the innovations in the business model, in the delivery mechanism versus, you need to go out and go for a walk. That's been around for a while. You need to wear glasses. That's been around for a while. But the delivery mechanism to get people on board is interesting.
Yeah, and I think, if you go back to that physiotherapy analogy, we go to an expert that can create a plan of care that can teach you how to integrate those exercises into your life, right? And then how to sustain it. We're doing the same thing on the brain health side. And so where the patient comes to us and works with one of our therapists, and part of the innovation, which you were asking around, is we've made the user interface a standard telephone, right? We talked about this last time, which I thought was like the old school meets the new school, where the patient is, any standard telephone is their portal into the platform. But then on the back end, we have a lot of sophisticated technology, including voice AI, to help our therapists scale their ability to deliver personalized care to that individual.
Okay, so day to day, I'm primarily talking to an individual or chatbot. Kind of what's my week to week regimen?
Yeah, it's sort of 65% of the time, the patient is speaking to a voice agent, right? And that's where they're doing their structured, repetitive exercises or receiving health education information.
And then, what kind of exercise might I do?
Yeah, so a great example would be if a patient comes to us and they're really concerned about their ability to follow sequencing of tasks, right? So how does that apply into their daily life? It would be following a recipe, being able to cook, which you can see then links to being able to remain independent, right? So our therapist would work with them and then build a progressive sort of task sequencing exercise. Give them a couple of steps, then ask them something, and then have them in a sort of a call and response return back to the activity to help them build that muscle of being able to follow a sequence. And then from a memory standpoint, it can get complemented by a compensatory strategy.
Okay.
So simple note-taking.
As in write it down. You don't want to forget? Write it down. So how effective is this kind of therapy?
Yeah, we just actually published an internal white paper. We did a statistically significant cohort of patients that have completed our Medicare reimbursed program. And this is from across the board. We work with health systems as well as patients self-referring into our platform.
Okay.
But we looked at close to 85 patients, and we're seeing a 20% increase in cognitive function, as measured against the national baseline benchmark, which is the American Speech and Hearing Association. They have a database which they look at in-person as well as telehealth and virtual cognitive rehabilitation. So we're outperforming.
Oh, okay. And this is self-reported, therapist-reported changes versus like EEG of the brain, where we're looking at changes in the brain. This is functional. Okay, behavioral, functional. Okay. Which is really what plays into the person's actual life. Can you do the things you want to do? Are you happier, more fulfilled? Okay, so last question. What's next? Where are you growing next?
Yeah, so we're currently available in 4 states.
Good. Reimbursed, you said, by
Medicare in 4 states. So
huge part of the business model.
So Nevada, Montana, West Virginia, so these neurology deserts, that's where we are, as well as Florida. And coming into 2025, we're going to be expanding. So we've signed some exciting contracts, which hopefully the next time we speak, I'll be able to put some names to this. But 2025 is really about commercial expansion, number one. Number two, product innovation. We've been building a maintenance program, which is completely voice AI driven.
Okay.
That when the patient finishes with their human therapist, they can, on a self-paced basis, work and maintain their gains. And then the third is publishing the evidence.
Nice. Obviously, that AI portion is like so scalable, so you can really bring this to more populations. Is that reimbursement strategy through Medicare, which I know you worked very hard on, is that a big differentiator in the market for you?
I think the main differentiators are the user interface, user experience, so the standard telephone call, right? The Medicare reimbursement, we've been able to, hit that benchmark. And then now we have been developing a proprietary voice data set from all of the calls and when delivering care, which is now several hundred hours of characterized speech that we use to train our model.
It's getting smarter and smarter.
Smarter and smarter. And then it also is used to complement or augment the capacity of our therapists. So it supports the patient experience and it supports the therapist experience.
Awesome. Well, Paul, thanks for the update. I love seeing you guys grow. Exciting that you're in 4 markets. Next time we talk, I'm sure there'll be many more. So thanks for the update.
Appreciate it, man.
Again.
Thank you.